I'm going to discuss the differences between FUT and FUE. FUT stands for follicular unit transplantation and FUE stands for follicular unit extraction. These are different methods of harvesting hair grafts for the purpose of transplantation. FUT is also known more commonly as strip surgery or the strip method. This particular method has been around for many years. It essentially requires the surgeon to use a scalpel and remove an area of the scalp in the back of the head to harvest donor hairs from. Once this is done and the incision is sewn up, the patient will be left with a significant scar and a post-procedure period of significant pain that typically requires narcotics to recover from. The FUE method is a more minimally invasive method where one hair follicle or groups of follicles are removed one at a time using a very small instrument, which is essentially a circular blade. There are a number of different methods of FUE, or follicular unit extraction. There are handheld methods where a device that looks like a pen or a pencil is used to individually remove these grafts. Typically a surgeon will do 1,000, 2,000, whatever is necessary for the case by hand. There are motorized versions of FUE as well, such as the NeoGraft, which many people have heard of. This is also a handheld device, but the circulating blade has a motor attached to it which assists the surgeon in removing those grafts, so again, one at a time. Then there is the robotic FUE method, which I will get into more detail in a moment. The drawbacks of the motorized and manual FUE methods include operator fatigue, the susceptibility to human error in terms of graft removal, and again, this is a handheld device. And so also another risk of this is over-harvesting of some areas of the donor area, which could lead to thinning out of the posterior scalp. The robotic version has many benefits. With the robotic FUE, the harvesting is done evenly throughout the entire donor area, so there is essentially no risk of over-harvesting. Because of the sophisticated software and magnification used with the robotic FUE, the precision and accuracy of the graft removal is unmatched. Typically with a motorized or manual FUE technique, in the best of hands you will get 80 to 85% yield. Again, that is in the best of hands. With the robotic FUE technique, we typically get 95 to 98% yield. What that means is 95 to 98% of the grafts that we harvest are implantable and healthy for the purpose of transplantation. A couple of more benefits of the robotic FUE technique include that we use a very small punch compared to many of the manual and motorized punches that are used out there for FUE techniques. What that means is that there is minimal to no scarring compared to not only other FUE techniques, but obviously to the strip method. Another benefit of the robotic FUE is that because, again, of the sophisticated software that is used, the robot can scan the donor area and pick out the grafts that have the most hair in them to take. So what that means is that we are getting the patient the most hair for the number of grafts that we're taking. And that again leads to the most hair for the patient in terms of their transplant procedure.